There was a time when I would see children who were obese, overweight. I would feel something within me, but I would shut it down really fast because I thought, how dare you judge a child for their weight?
But without a doubt, we are in the middle of a global health crisis and junk pandemic. In 2020, the World Health Organization, WHO, labeled childhood obesity an epidemic and one of the most serious public health challenges of the 21st century.
What's the impact of poor diet on the growth of children?
Visit the hospital, visit the clinic. We have a lot of children coming down with type 2 diabetes.
A 2023 study by the WHO found a global rise in childhood overweight and obesity, affecting over 39 million children under 5, and given the current trends, the World Obesity Foundation's World Obesity Atlas in 2023 predicts that obesity figures from 2020 will more than double 10 years from now.
So over the last 3 generations, we've actually seen a big decline in our children's health. We have compromised our children's health over convenience. Manufacturers of food packets and processed foods have convinced us that actually they can do a better job than we can to feed our children. Nothing is further from the truth.
But if there's one thing I've learned as a clinician and as a parent, is that you want to make the hard choices now, so that your children will not blame you as adults when sickness and illness force them to make those choices later.
Dear parent, is there death in your pot? Because with every food choice, we are either setting up our children for wellness or sickness. It's time to save our children. Isaiah 49:25b, for I will fight those who fight you, and I will save your children. Why are we vocal about this? Why are we sounding the alarm? Recent data from UNICEF reports that around 45% of deaths among children under 5 years of age are linked to malnutrition, and Nigeria has the second highest burden of stunted children in the world. But did you know that a child can be overweight or obese and yet malnourished? Let's hear from Kenny Ebele, a registered dietitian and pediatric nutritionist.
Back then, undernutrition was really common in Nigeria. Like, it used to be the major form of malnutrition among Nigerian children. But these days, we have overnutrition, we have micronutrient deficiencies. Overnutrition in form of obesity. Children are getting obese.
Dr. Babayemi Osinaike, Senior Consultant Pediatrician at LUTH, has this to add.
Let me start by saying very early that when we hear the phrase poor diet, it's so easy to think of being undernourished. But poor diet also would encompass the intake of a large quantity of junk, and both extremes would be what we are considering as poor diet.
Malnutrition is no longer just about low-income families, but it's also now about more money and spending it on all the wrong foods. And what is the growing impact of this on our precious children and their health?
Just because you are not seeing the immediate effects of loading up your kids on junks now doesn't mean nothing is happening to them.
Food matters. Healthy food matters. If we're going to avoid weak and compromised immune system in our children, healthy food matters.
There are immediate signs of malnutrition, and there are future effects of malnutrition. Going back to the issue of recurring cold and cough, because this is very common, we see this a lot. In fact, most parents don't even visit the clinics anymore to get me. They know what to give, they don't know what to offer. And all these things are pointing to the fact that their immune system is low. Their immunity is really, really low. Their immune system is getting weakened. And this is pointing to the fact that they are not getting enough nutrients like iron. They're not getting enough nutrients like zinc. They're not getting enough nutrients like choline. They're not getting enough nutrients like vitamin B12. We can continue to name them.
And beyond their bodies, poor diet also affects their minds and impacts their learning both at school and in religious institutions.
These days, children are losing concentration easily. Like you see Sunday school teachers, you see school teachers complaining to parents, oh, it's not that your child is not good, it's not that your child is not brilliant, but most times she loses concentration easily. You can point this to their diet.
The Center for Disease Control and Prevention, CDC, reports that children who are malnourished or have inadequate diets are more likely to experience problems with concentration, memory, and overall academic performance. Dumebi Ehigiator, an educator with over 15 years of classroom experience, buttresses this submission.
Children from homes where healthy eating lifestyles have been embraced, they do better in the classroom. They have better grades, higher scores, more involved, like I said. They are able to learn effectively throughout the school day.
The truth is, we have a junk pandemic on our hands, and we need everyone, parents, teachers, doctors, religious organizations, and the society at large to fight this monster that is robbing our children of a healthy childhood and sickness-free adulthood.
The fact is, our kids' health is rapidly declining. More kids now than ever are dealing with eczema, asthma, hay fever, atopic conditions, allergies, diabetes, obesity, and behavioral disorders like ADHD, OCD, autism.
Visit the hospital, visit the clinic. We have a lot of children coming down with type 2 diabetes. We used to know type 2 diabetes as a disease for adults, but right now children are coming down with type 2 diabetes.
But what is the cause of all these? Hear what Dr. Babayemi Osinaike has to say.
One of the things we've noticed over the last couple of years is that there is an increase in non-communicable problems, especially problems with weight. So obesity, for example, is a major health challenge in children that is on the upward swing. And this is directly related to the type of diet, is related to the unhealthy lifestyle that our children are being brought up in now. Exposure unnecessarily to junk, unbalanced diets, reduction in physical activity, so they don't even get to burn the unnecessary calorie they accumulate from all of these unhealthy diets as well.
How was it in the past? How did our parents navigate this healthy eating and lifestyle business?
Growing up, my parents actually were very big on food. And from very early on, I knew that if you didn't have any need going to the hospital, you could actually get, better just doing one or two things at home, which included sleep and good food. So that has actually kind of molded and modified my lifestyle growing up and into marriage and raising children.
So the system is broken. It's not working. Our parents and our grandparents didn't have to deal with the health issues we have to deal with as parents for our children.
It is indeed heartbreaking. Some of the most devastating yet avoidable health challenges we will be setting up our children for if today they are being fed to fail.
Parents want their children to do well. Parents want their children to thrive. Parents want their children to be successful. Parents want their children to be happy, energetic, involved.
But wait, don't fall for this mistake that many parents make when it comes to feeding their children, especially with how busy life can get.
Parents, as it were, try to overcompensate in terms of what they give the children. It's almost as though there is a guilt consciousness of being absentee parents these days, and so we think that we need to throw the children literally into the river of food, and so we indulge them. Mommy, can I have this? Daddy, can I have this? And because we really have a guilt consciousness that we haven't been there for them as we should be, we literally just allow them, oh yeah, you can have this. And it's almost as though we are just trying to do penance emotionally.
Oh yes, we must save our children. It is a battle we are winning, and we need as many hands on deck as we can gather.
Now, when it comes to influencers on child nutrition, there's a lot of focus on the home. However, there are two levels of influencers that I want to spotlight, even with the Wellness Champion book launch, book series, and all. And that is one, the educators in schools.